Good morning, good afternoon, and good evening to all. First of all, welcome to our third episode of the Healthier Population webinar series. My name is Dr. Taksapon Thamarangsi. I'm Director of Healthier Population and NCD at the WHO Regional Office for Southeast Asia. But please call me by my nickname as Meg. So it's great to have you for today's episode. Today we discuss about healthcare waste management, COVID-19 and beyond. But first of all, let me introduce about the webinar series first. So we run this webinar series every Thursday lunchtime in South Asia part, a little bit early afternoon in Southeast Asia part. Please feel free to grab your healthy meal and then join both food for thought and food for your body at the same time. Okay. We have the topic, changing topic based on the vote, the polling that we done with country, that this is the issue the member state of the WHO in Southeast Asia region required in this context of COVID-19. All webinar material, technical tool, and PowerPoint, including today, will be in this web page. In your registration part, you will have this web page. Next, please. Next slide, please. In that, to go to that web page first. Do we have slide for web page? No. Okay, you go to that one, is this one. You will see a lot of material, the tool, the advocacy material, the video. You have just saw it 5 minutes ago. That's all included in this web page. And if you want to archive it later on, it will be under the previous episode. You click on the name. Now let me introduce the ground rule. Okay, can you go back to the ground rule? Hope we can improve the resolution clearness. But first of all, this is open to all. This is very informal and technical, but we would like to respect each other. We welcome only registered participants, and you have successfully registered for this very easy process. And please mute your microphone at all times. And then in this webinar series, we have two parts. One is presentation for the next 25 minutes, and then we have Q&A. Everyone will get a chance to contribute to the webinar. Apart from our panelists, you can type your question, comments, or you can show what you practice in your area under the chat box there. Today we have only one chat box, and please add that to all attendees. And then moderator, me, and rapporteur will select some questions to be read out. We have 2 rounds of Q&A. And then the last thing is that we cannot provide certificate, either the paper-based or e-form, but you have certificate of the knowledge when you attend today the session. Next, please. Panelist slide, please. Okay. In your when you got your flyer, you will have the chance to read. Sorry for this resolution. Our team will try to improve this resolution to make it more clear. I'm talking about healthcare waste management. The World Bank just recently published about in terms of general waste, our area, either South Asia and East Asia and Southeast Asia, I expect to have a much increase in terms of waste generation. It is expected that by the year 2050, South Asia will produce 661 million tons of waste. That is 2 times higher than today. And so to our East Asia and Southeast Asia. And if you look at the waste that we call healthcare waste, healthcare waste contain both general waste, which is around 70 to 95%, but it contains, on average, it is 15% of our healthcare waste management are so-called hazardous waste. It contains hazardous material, either in terms of infectious, toxic, radioactive, pathological, sharp, or chemical waste that is very hazardous. And we have the issue with how to manage healthcare waste management. Healthcare waste management cannot be managed by healthcare sector alone. It has to involve with other sector. In terms of hazardous waste that I'm talking about, in high-income country, it is estimated that it is around 0.5 kilogram per bed, per inpatient, per day. In low and middle income country, it is a little bit less than that. The issue is not about how much they produce. It is about how much we can manage. In particularly in the time of COVID-19. COVID-19 has a tremendous impact to waste management in many ways, and particularly on healthcare waste management. Firstly, it's no surprise we have seen sharp increase in terms of amount of waste generated from healthcare activity. World Bank estimate that it will be increased by 40%. So that is one, increase in amount. Second, it has effect on redistribution of waste management. Healthcare waste management are not only in hospital or clinic or laboratory, because we extend the service, the medical service to everywhere. Just think about home care, home isolation. Think about we have a few hospitals set up and many others. So it changed the whole landscape of waste generation. And the third, it has some change, affect some change in terms of waste management practice. Some cannot be practiced right now because of the lockdown, because of the shutdown of public service here and there. So it is a big challenge. And as you know very well that we have to live with it for long. Today we have very knowledgeable panelists. We have practice from 3 countries, from 3 sectors, and 1 global level. We have Dr. Malini Kapoor. She will represent academic and also practitioner point of view. From India, we have Mr. Mahesh Nakarmi. Apart from technical expert, he also runs a civil society organization on this issue. From Nepal, and lastly, from the government side, we have Mr. Amit Martasa, Director General from Ministry of Environment from Maldives. So 3 sectors, 3 countries, and close by our global expert, Dr. Oud Pieper. She's a global expert in this area to show and benchmark how will we progress in terms of healthcare waste management in our region. With no further, can I invite Dr. Malini Kapoor to have a 5-minute presentation. Over to you, Dr. Malini. Dr. Malini, can you unmute your mic? Organizer, please.
Am I audible?
Okay, yep.
Yeah.
Okay.
Good afternoon, everybody. Greetings from India. Best wishes for all the COVID warriors working in the healthcare waste management and of course for treatment and diagnosis also. And thanks for WHO too for inviting me. And we all know about this virus, that it is a lipid enveloped virus. It is droplet and contact borne, and it is killed with the common disinfectants like ethanol and sodium hypochlorite and hydrogen peroxide also. And it can be killed by the heat also, mainly from the moist heat technologies like the autoclaves, and then you have microwaves and hydroclaves too. Next slide, please. Next. Yeah, so if you look at the Indian scenario, India has one of the very strict and stringent rules, biomedical waste management rules 2016, 18, 19, and we have the COVID-19 guidelines for healthcare waste management, both in the hospital setting and in the home care setting too. And India has also a court tribunal, that is the National Green Tribunal, who's looking after all this. And these rules, they are based on the material recovery and the color categories, the infected plastics, sharps and glass, and small amount of waste goes for incineration. Next slide, please. These are the CPWD guidelines which are there on our website, which have been updated as per the information received from CDC and WHO. These are Central Pollution Control Board guidelines. They focus on the effluent treatment plant, the autoclaving or the microwaving of the lab waste, and the facility at the common facility level. Next slide, please. In these guidelines, labeling is ensured of the COVID-19 waste so that the waste is disposed on the expedient basis, and the color codes are given to various containers, bins, bags and containers, and even the inner and the outer surface of the containers, bins and trolleys are disinfected with 1% sodium hypochlorite, and general waste not having any contamination, it is to be covered under the municipal solid waste rules. Next. And this is a typical isolation ward wherein the social distancing norms, the waste is being handed over from one healthcare worker to the another healthcare worker, especially the sanitation worker, who is donning proper PPE and is maintaining the social distancing norms. Next slide. And pre-treatment is recommended of the laboratory waste, the samples, the blood bags, and the RT-PCR, the TrueNat machines, and the Gene Expert machines, and the other lab waste, whatever we are generating. Next slide. This is how it is done in the labs, and autoclavable bags. And then if it is plastic, then it goes in the red category, and if it is glass, then it's respective category. Next slide. And this is the management of wastewater from healthcare facility, how the operator of the wastewater needs to wear the PPE and what are the standards in COVID context. Next slide, please. And so if you look at healthcare waste management in COVID-19 context, there are definitely challenges. We are overcoming them. The training has to be in social distancing norm, the collection of waste, the barcoding, hand hygiene, respiratory etiquettes, and all the general population which is using PPE, we need to take care of that too. But that is under different set of rules. The health checkup for COVID-19 is being carried out, the ETP, STP plants, and there is a mobile tracking app of Central Pollution Control Board, which monitors on daily basis the amount of COVID-19 waste generated. Next slide, please. And so these are some international documents which are available. Apart from your national guidelines, you can use them, the WHO document, WHO WASH document, and they are periodically being updated right from 3rd March, then 19th March, 23rd March, then in May. And one important WHO document, which is on 15th May, that is cleaning and disinfection of the environment surfaces, is very helpful. And the earlier WHO document and the USDP documents for healthcare waste management and safe management released in 2014, then 17 are very, very helpful. All of you can use that. Next slide. And so if you look at waste management in COVID-19 context, you need to treat coronavirus waste like any other infectious waste, segregate at source, dispose in color categories, and use PPE and use the safe and environmentally sound treatment methods. And there are hybrid stream systems, microwaves, autoclaves, and for low resource setting, you have chemical disinfection, you have a pressure cooker kind of autoclave with a setting of at least 30 minutes, then sanitary burial is there, and follow the routine disinfection practices. Next slide. And disposal of waste in the community level. So it is best to keep the waste for 72 hours. It is mentioned in CDC also for masks, keep the mask for 72 hours, and then you can treat them as municipal solid waste. Next slide, please. And there are certain treatment options I've mentioned in my opening slide also, like the 70 to 90% ethyl alcohol, sodium hypochlorite at 0.1% for community disinfection if you're doing, and for hospital setting 0.5%, then hydrogen peroxide 0.5%, steam-based treatment technologies, and you should have the sustainable technologies, and recycling after the sterilization or the disinfection has been carried out. Next slide, please. And you know, these are some common disinfectants, like if 1% bleach can inactivate, or if so hydrogen peroxide can inactivate, so do other technologies like autoclave, microwave, alkaline hydrolysis, dry heat treatment, hydroclaves, managing the stat criteria of log4 Next slide. And so these are the key messages. Healthcare waste management is duty of all stakeholders, need to be practiced with social distancing norms, hand hygiene, personal protective equipment, respiratory etiquettes. You need to follow your national rules and follow the international guidance which have been updated from time to time, whether it is of CDC or WHO. General population need using PPE in the municipal solid waste bin, and you need to decrease your incineration category waste, follow the best available techniques and practices. And so therefore, healthcare waste management is an essential health service, and it's an important public health concern. It's not only a legal responsibility, but also a social responsibility. Thank you.
Thank you very much, Dr. Malini. That's so clear. So you talk about the importance of having national guideline in hand before, and then about implementation, empower and educate all actors, and then have some system for audit and monitor that part also. And then pre-treatment using the global benchmark as to support country. Thank you very much. For all attendees, we are trying to address the issue of some of you complain about the hazy of PowerPoint, some of you say clear. So we try to check, but let's see what we can do. Please, anyway, don't hesitate to put your question or comment. We have seen some very good question and very context-specific question, particularly in the COVID-19 about resource limitation. What should we adapt? But I will leave it to the Q&A session for our panelists to explain. And you have a lot of fans, Dr. Malini, in your chat box. Thank you very much. Now, can I move from India? We can move to our Indian neighbor, Nepal, Mr. Mahesh Nakarmi. Okay. Yeah. Mahesh, the floor is yours.
Yeah, hello. Hello.
Yep.
Hello, good afternoon, everyone. And I'm thankful to WHO for inviting me as a panelist for today's webinar. And I'm going to talk to you about the safe healthcare management practices in Nepal and lesson learned and challenges in the context of the COVID-19 pandemic and beyond. So we are talking about not only COVID, we are talking about more about other emergency also. Can I have a next slide, please? So first I would like to talk to you about the overall system, what we are implementing since decade-long experience we have on this. We are trying to do a zero waste on the zero waste principle, zero burn, zero risk. These are the three principles we take when we talk about the waste management system on the hospitals. And basically we start from the waste generation point to the waste disposal. So when we talk about that, there are a lot of other issues like the color coding things, segregation practices, everything else, and also comes the technology side. Technology side is very important. Treatment technology is very important. and we are the one who in the pioneer in Nepal to implement the non-burn technologies. I think we are thankful to Dr. Ute Pepper, who came in 2007 in Nepal and encouraged us to do in that. And also, I would like to thank our partners, Healthcare Abraham, Dr. Ruth Singer, WHO Nepal, JIJ, all our partners are working the same line. So in this context, I have put some of the points here about the treatment technology, autoclave, microwave, or the incineration. So we see that autoclave is very much low cost. I mean, in terms of operation, in terms of the investment cost. It also have a good resilience system, very low to the climate change. It contributes very low to the climate change, and also it allows the recycling. It has a low toxicity, low maintenance, and also recycling is possible when you do autoclaving and microwaving. But when you talk about incineration, it's all a lot of things that we have a problem. It has a carbon dioxide emission. It has a dioxin, furans emissions. It has a other pollution things comes up, and toxicity is very high, and also it needs a lot of high financial investment and also operation. We don't have that technology very feasible to Nepal. So we are since last 10 years ago, we are trying to promote the non-burn technology, especially autoclaving, and we are doing a lot of autoclaving in hospitals. And now also we are trying to do the microwaving, also starting the use of microwave, because there are a lot of microwaves being available in the market. So in this context, I would like to say the autoclave is even cheaper than incineration, and it has a good testing capacity. We can do a very good in-house testing, like the spore testing, and say whether the autoclave is working or not. So in overall, it gives some kind of a environmentally friendly and also safe in terms of safety also. So another is I want to talk about is that the recycling is possible in the autoclaving also. It gets some money for the hospital also. So it is a kind of a circular economy. It also contributes to circular economy. Can I have next slide, please? I want to just talk about the emergency situation on the healthcare waste management. We'll talk about earthquake, because we are the one who has a 2015 earthquake. We have a lot of lesson learned. And when we talk about healthcare waste management during emergency, we can see that other system may fail or problem after earthquake, but this system, if you see the star in my chart, it's a little bit small star there. That star is the date of the earthquake, and after earthquake, it is already on 4 or 5 days. The autoclave is already operated. The waste management system is back to the normal. So it shows that there is not of lost. So this is not only in government hospital. This is in NGO hospital, private hospital. Everywhere the waste management system is back to normal. That shows the resiliency. In terms of the analysis of those, the lesson learned from those is not a problem if the waste increase, because in terms of emergency, the infectious waste always increase because they do not follow the regular waste segregation system. So a lot of waste being increased. So even that waste increase is not a problem, because you can just add more shift. So you can manage you can treat the waste properly. And of course, segregation system will be not workable that time also, because this emergency, people will panic. They don't know where to put what. There are no new doctors come in the shift, and all those things like that. Even volunteer doesn't know how the system works. There are a lot of volunteers available in the earthquake, and hospital wards was moved because due to risks in the damage due to earthquake. So it comes to, so I think these all are the problems we are seeing. And when we shift the ward, the waste bins and needle cutters are also left behind because they could not take out it. So there are a lot of issues that are there. Those are management issues which can be solved. When we talk about it, we have a proper emergency planning and training guideline, emergency planning guideline and the training for the staff for the emergency situation on the waste management part. So in waste management, we have needle cutters, very important. Next slide, please. So another thing I want to talk about is now the corona case. So in our first corona experience is when we have evacuated the 175 Nepalese from Wuhan. It is in 2020 February 14 evening or 15 morning. So it was a nighttime operation. So we have a big problem how to manage. We have no idea. Whole world was in panic how to do it. So we also have a panicking, but we try to set up like we have the waste problem is from airplane, which we used by passenger, which we thought contaminated passenger at that time. We thought all the waste is contaminated waste. So that's how we collect them in biohazard drums outside the plane. everything was absent. You can see, and then that plant that was disinfected outside surface. But we don't know at that time, not of knowledge about coronavirus, how long, how many days it will stay or like that. So then we transport to the three big centers, TU Teaching Hospital, National Kidney Center, and KMC Teaching Hospital. These are the three hospitals which we government has approved, assigned to manage these waste. So we have every day after the shift of the hospital were managed to manage this COVID-19 waste in each hospital. So it took us to manage 5 days to 8 days to do all these things, and every operation was monitored by the government from the Health Emergency Operations Center and the management division of the Department of Health Services were closely monitored, and we have closely discussed with them. And this was possible due to close collaboration with our stakeholders like GIJ, WHO, Nepal, and UNICEF, and the government itself. So we have a whole stakeholders united to one now for this operation. Next, please. Next slide. So after that, now we have a regular corona cases coming up. So we have the government has developed in our collaborative effort. We have developed the healthcare waste management COVID-19 guideline, and it was mostly we are talking about the corona contaminated waste, how to manage the different part like the sharp waste, like the other infected waste. So everything is in guideline, and we are still trying to say that it should be segregated. It should be transported separately, and also it should be managed either by autoclave. The autoclaves are different autoclaves you can make. You can have a manual autoclave. At the moment, if there is no automatic autoclave, pre-vacuum autoclave, we can recommend pre-vacuum autoclave is the best. Then maybe manual autoclave if you are not available pre-vacuum autoclave, and also you can do a biomass autoclave if it is not available the pre-vacuum autoclave. It depends different situation, and also you can use microwave. And some of the hospital has used the microwave to do this, and it gives a proper result. So on this, we can say that. We can say that in this aspect we have some lesson learned. Initially, staff were confused because corona has made a lot of confusion in all over the world. So it by nature, and staff has a fear, and the staff didn't want it to go and pick up the waste from the ward because they said it's contaminated. I will be infected. So a lot of havoc was created all over the world. Like it's the same thing to Nepal. It's also in Nepal. But there was lack of PP.
1 minute. 1 minute
okay.
more.
Lack of PP, and then all this. Can I have next slide, please? So I just have to point out few challenges, lesson learned, and recommendations. First of all, one is the chaotic panic. I told that. Lesson learned is that much of the communication was really poor in the beginning because staff didn't get the training on proper time. A recommendation was we have to act quickly, resolve systematic problems. And second one is the ad hoc manner. This was handled ad hoc manner. So I think these are all are here. And then I want to just talk about the PPE. There are a lot of PPE where have a problem with the SOPs and unclear. So actually the supply could not supply the equipment and PPEs on time because they were not available. So those are all lessons learned, and we have guided some recommendation. Can I have a next slide, please? So I just want to give one message. Healthcare waste management should be an integral part of healthcare system and prioritized equally with other life-saving aspects of the system. At the moment, it is not happening because healthcare waste management is still neglecting part because it's still in the outside the system because there are no proper management mechanism to bring that. So I would like to give this message to everyone that this should be the first priority message from my side. Thank you very much.
Thank you very much, Mr. Mahesh. That's so clear to us. And what is we learn very well is that our experience is not a waste, particularly for Nepal, to draw some lesson learned and experience to deal with earthquake in 2015 and use it at this time. Although we have a very new challenge in terms of COVID-19. That's to change the whole landscape of demand and supply in terms of and practice in terms of the healthcare waste management. Next, we go a little bit south to the sunny side of life, Maldives. Can I invite DG Ahmed Martasar from Maldives? Ahmed, the floor is yours.
Thank you very much. Yeah, thank you very much. Can you hear me?
Yes, we can hear you.
Yeah, thank you very much. I will have a very brief presentation, which has only 6 slides, because I was asked to have 5 slides, so I have only 6 slides. And just because I'm expecting that everyone knows about the Maldives, so I will not go into the introduction of about the country, about the profile of the country. So I will start from the history of the waste management in the country, which the government has made a lot of efforts starting from 2000, which was trying to have a proper waste management system in the country, but due to the huge investment involved in the country, it was until recently that there was only a way of infrastructure investment in the waste management sector, so to develop to have a proper waste management system. And you can see the history of the Maldives. We start from 2000, and now we are having 2 big projects funded by World Bank and ADB that are having the waste management practice, a good system in place. And that is under the implementation at the moment. Next, please. And if you talk about the current situation in the Maldives, in the islands, the waste management is very poor. The people are waste is open burning and open dumping, and sometimes sent into the shore, and that leads to into the sea. And next, please. Yeah, if you look at the waste generation, I think the major portion is 60% in the islands and 74% in the resorts. So that is the major portion we can deal with on the islands. And due to these challenges, the government has brought up a policy. In the Maldives, there are 2 separate policies for the waste management. One is the national policy, and the other one is the health policy, which is responsibility of the Ministry of Health, because the national policy says the healthcare waste should not come into the main waste stream because of the infectious before the disinfection. So the Ministry of Health come up with their own policy with the principles of consider preventive and precautionary approaches with the proximity principles of course, the healthcare waste has to be pre-treated within the premises of the healthcare facilities and then sent to the disposal. So I would like to say that due to the pandemic, due to the pandemic, the Health Protection Agency of the Maldives come up with a guideline for the healthcare waste that has that they divided waste into 4 categories. That is general waste and infectious waste, which has to be dealt autoclaving before it's sent to the disposal. And then next, please. Next, please. Again, next, please. The last slide. Yeah, in the Maldives, we are now currently trying to put in place a 5-step waste hierarchy, which is known by the Universal. So after we implement these projects, I think we will have a proper waste management system in the country, and the government is now trying to have, due to the geographic nature and disperse of the islands, the government is trying to have a regional facilities into the country that is supported by the islands, that the islands will have a separate collection points and pre-treatments on the islands, and then sent to the final disposal into the regional facilities. So from this slide, you can see how we are going to have this system into place. So some my slides. Thank you. If there are any questions, I'll be happy.
Okay, thank you very much. I'm sure there will be some question and comment to you, DG Ahmed. DG Ahmed, raised a very important 2 points. One is about the synchronization, or later you call integration of policy relevant to waste. One is at national level, another one is health policy, and they should go hand in hand together. And second is about the context. specific and then context friendly. That part is also important because the countries are similar in the sense. And then at the end, you raise one interesting to me that waste management should be part of the circular economy and value added chain. So that that is a new term that economics use very often in recent time. I have seen a lot of questions and a lot of comment going on. But then I will wait until we have the next speaker, Dr. Ud Pieper. Dr. Ud Pieper, the floor is yours.
Thank you very much, Meg. Good afternoon, everybody. Greetings from Berlin. So I just would like to provide some information about the guidance of WHO from the WASH unit in the headquarter. Healthcare waste is part of the WASH unit in Geneva. Next one, please. So here we have different guidances. Dr. Malini already mentioned some of them. Thank you for that. So regarding COVID-19 virus, healthcare waste management is, as I said, part of the WASH area. So the main document here is an interim guidance on water, sanitation, hygiene, and waste management. For the COVID-19 virus, it's an interim guidance from WHO, which is updated regularly. So the last version has been issued in April, but now they are working. We are working already on a new version, just to answer all the questions which are coming up during this outbreak. So there will be a new release soon. I think within the next 1 or 2 weeks there will be a new one. Then we have no, not yet. Please go back. Thank you. So then there are different guidances, like an overview of technologies for the treatment of infectious and sharp waste. This guidance has been published in 2019, and it provides quite a good overview about different treatment possibilities and how to sort out which technology is really suitable for your situation, how to select the treatment technologies, what are the requirements of these treatment technologies, and also some cost indications. Furthermore, there is the Blue Book. In general, I think most of you know that. That's kind of the Bible of healthcare waste management, issued by WHO. The last version was in 2014. And it's a very comprehensive one. It's like 200 or 300 pages. So more or less each question you might have, you will find some answers in there. But there's also a summary document on that, which is quite brief and gives you a quick overview about the main issues on healthcare waste management. Next one. So talking about this interim guidance on WASH and healthcare waste management in this COVID-19 times, I just would like to highlight the basic approaches. So in general, you should just follow your normal segregation and healthcare waste management systems, which you hopefully have in place anyway. So waste from COVID-19 patients is considered as normal infectious waste. So in a lot of cases, people are asking, but do we have to do more than that? No, you don't have to do more, but you should enforce your current system on segregation, proper collection, transport, storage, treatment, and disposal. Next one. For the treatment of this infectious and sharp waste, WHO is calling stakeholders to uphold the Stockholm Convention on the persistent organic pollutants. So that means to prefer the use of alternative treatment technologies like autoclaving, or to use high temperature incineration, if possible with flue gas treatment, which is in accordance to the Stockholm Convention. Of course, I know in low resource settings or emergency settings, we need to do whatever we can. So transition methods can be used, but in general, please try to improve the system also for the later stages. In a lot of countries, healthcare waste management is set as not a priority. So, but when we come to a pandemic like this one, suddenly everybody says, oh, now we have to do something with waste management. And after the pandemic situation, it is forgotten again. So please try really to put healthcare waste management in your normal routine work and improve it in general. Next one. So how about waste from in these times in patient waiting areas or at home? So in general, when you have waste which is generated at home, it is considered as non-hazardous waste. It should be packed in strong black bags and closed properly before disposal by the municipal waste services. It is really important before you just go and call for more treatment equipment, for example, to assess your system. So what is already there in your country? What kind of treatment systems and disposal systems do you have? And don't just think, okay, we need more. We need to buy something right now. Really have a look, what do you have? And maybe you can increase your capacity by using your treatment plan, for example, more extensive, like to use it in 2 shifts, or not only 5 days a week, but 7 days a week, so that you don't burden your country with some treatment equipment which is after that not used anymore. And also for the waste handlers, these are also people are often forgotten. They should really wear appropriate PPE, boots, long sleeve gowns, heavy duty gloves, masks and goggles, or a face shield. And what is always important, hand hygiene, hand hygiene, hand hygiene, hand hygiene. That's a very simple part, but very important in that. Next one. So here we have the relevant references. So like Dr. Manini also outlines, you can download a lot of very fundamental healthcare waste management documents and guidances, which are readily available and easy to assess. Yeah. So yeah, thank you very much for listening.
Thank you. Thank you very much. Yes, thank you very much, Dr. Woodpiper. So for all attendees, please share your question or comment in your chat box. We have a number of chat box. I will ask you to read 1 or 2, and then I will read it for 2 or 3, and then we go for all panelists to have their second round of contributions. We have quite close to each other from Amon Wind. Sorry if I pronounce your name wrong. From Myanmar, talking about please clarify about the strength of hypochlorite solution in India. I've seen 1% use. In Myanmar, you recommend 0.5% in health center and 0.1% in public area, which is quite close to one question from Sudan Party, talking about 1% of this chlorine. And what percentage should we allow for resource limited setting? So that is one question. Can I go to live question from Dr. Iqbal? I'm not. Dr. Iqbal, are you online? Dr. Iqbal, are you online?
Please unmute. Unmute.
Unmute, please. Dr. Iqbal, please unmute.
Please unmute your mic.
And then we have, before we go to Dr. Iqbal, we have the question from Ms. Indira talking about the effectiveness of common disinfectant like Dettol. How can we use in various settings? Dr. Iqbal, are you online yet? Yep.
He's.
Yep, you are on. Please deliver. We can hear you. Right, Dr. Iqbal. Okay, can we skip Dr. Iqbal for the, can we go to Dr. Tushara? Hello, is Dr. Iqbal?
Dr. Iqbal, yes, speak, please.
Yeah, but I think I am not the right Iqbal. I'm Iqbal from Oxford, WHO. Maybe another.
Oh, sorry. Yep, but your question is okay.
All right.
Yep. You asked question about the practice in resource limited setting, right?
Sorry.
Okay, if I may read your question from the very beginning, you talk about what is the recommended practice to okay. What is your question? Can you deliver? Sorry, I can't find your question.
Hello, I made a question. It's not more like a comment. Like
Please deliver. Please deliver your comment.
That comment is like in a low setting resources, and especially in emergency situations, like we have in Cox's Bazar, we have hosting 1 million refugees in Cox's Bazar in a very congested situation. Like here, the resources are very limited. So while Dr. Malini was presenting her presentations, at that time I made that comment, like it's hard to follow all these facilities. Like for example, the bean liners, color coded bean liners is not likely available in places. So that was a comment actually. So
okay, thank you.
I got Ute presented respond to that one, like in a low resource setting, we have to follow emergency, but we have to keep in mind that we have to development later. We have to go through like that one.
Yep, that is a reality.
Thank you.
Thank you very much, Iqbal, from the Cox's Bazar. Can we go last question for the first round, Dr. Tushara, and then we go for the all panelists. Dr. Tushara, 30 seconds for you.
Thank you, Mick. I hope you can hear me. Thank you very much to all the panelists for your excellent presentations. A quick question from the panelists. Do you think that what WHO we are doing enough to help the countries specifically in this area, or do you see any gaps where we can come in stronger? Thank you. Over to you.
Okay. Thank you very much. Can I go one round for panelists? Can I start with Dr. Malini?
Yeah, actually WHO is releasing its documents from time to time based on the current knowledge and updating also. That is a very good step, because based on those WHO or CDC documents, we are updating our guidelines as per the national regulations, whatever the practices and the policies, whether in the hospital setting or whether in the community setting, especially in home care waste management. So we are adapting those guidelines. But what I would request WHO is for those resource limiting countries, like they could have trainings there for small size autoclaves, like the pressure cooker autoclaves, if they can use them, and these kind of guidances, if these trainings they can conduct in the small resource settings, like if you can have, like India is using its resources, but what about other countries which require just I think 3 minutes prior, I had a query from one participant from Cox's Bazar, like they don't have liners, so they can use other bins. Or in that context, WHO can play a very important role in bridging the gap, because they are ready to follow the guidelines, but they don't have resources. So what troubleshoot or small resource settings, like WHO has already mentioned, like 0.1% hypochlorite for community settings, surface disinfection, and then 0.5% in hospital. But what about the other small things, like small autoclaves, pressure cooker kinds, or some things they can take training in the resource limited countries. Yeah.
Thank you very much. Can I go to the Mr. Mahesh? Mr. Mahesh, please unmute your mic and deliver. Yep,
yes. So actually, WHO is helping us a lot in a way, in some way, because but the WHO itself has a resource constraint. So, and especially in waste management sector, I think WHO has to increase the financial resources and help to countries like ours, like even the resource constraint things. This is very important. And in context that now the guideline of WHO is coming frequently, and that is very helpful for us. But still, that WHO should be very clear about use of incineration, because we are talking about Stockholm Convention to reduce the POPs, but some way we are not saying definitely that incinerator is not the proper technology for the resource country like ours, because the resource country countries couldn't afford the big high-tech incineration and this operation. So we have to be WHO should be very clear instruction on that, what technology is good for the developing countries and which are the best technologies available, and in that countries we have to work on that. And we are in country of Nepal, we are very closely working with WHO Nepal. We are discussing all these aspects we have very good stakeholders unity here, all the development partners, JIZ, WHO, UNDP. There are a lot of other USAID, a lot of all partners, UNICEF. All these partners are united and working with the government closely with our NGOs like us. So, but still, I want to force that WHO should have an increase in the resources and bring these resources, focusing on the waste management practices, not as a broadly like something like a environment or something like a other things. So this is one my comment on that. And I think the COVID-19 was good in that aspect, that the stakeholders are being together. And I think beyond COVID-19, we can work more closely on that.
Thank you.
Regarding the question from Iqbal on Cox's Bazar, I want to ask, we worked in the Cox's Bazar last year. We did assessment in the Cox's Bazar. So in that context, I think the liner, the bucket is a problem everywhere, not only in Cox's Bazar. Even Kathmandu now, we don't have a color coding bucket. After this lockdown, this is not available. So I think we should not delay saying that there is no color coding bucket. We can make a label color coding printing. We can make a label and just put in the same color bin. It's not a problem, because bucket system is not important. Physically, that is a physical thing only. If you have a knowledge on doing segregation, let's do same color bucket but different color labels. Label could be printed in any color. So that could be one solution for Cox's Bazar, and I think we can talk more on that later in the offline time. Thank you.
Okay, thank you very much. DG Ahmed, please.
Thank you, but I think I'm not the right person to comment on that.
But that is one question to you about what the WHO should do. Yep.
Yeah, but if I can comment, I think the WHO is doing WHO is doing its best for the countries, but I think it is for the governments to come up with programs and then collaborate with get collaboration from the WHO, and also I think WHO should also consider doing these guidelines, separate guidelines that can be adopted in separate countries, because separate countries have, the nature of the countries are the cultural situation is different. So I think the common guideline, if they're coming up with to address all the things in all the countries, that is not helping. But if they come up with some separate guidelines for the separate countries that can be adopted in those countries, would be helpful.
Thank you. Feasibility is a very important part. Dr. Ut, many questions specific to you.
As I said, so I'm just reading the questions in the chat box. So I just would like to highlight again on the percentages. I just put also one of the answers already into the chat box. So for the disinfection of surfaces, so WHO recommends sodium hypochlorite of 0.1% percentage for surfaces and 0.5% for blood fluids and spills and so on. So this is the guidance of WHO on that. Regarding the segregation, like food waste from COVID-19 patients, please just really enforce the system you have in your country. When your national regulation says food from any infectious patient or patient with an infectious disease, let's put it like that, has been considered as infectious waste, just go ahead and do the same. So you don't have to change your current system, you just have to enforce it. Yeah, so this is my main message. And again, regarding autoclaving and incineration, of course, WHO as a UN organization calls everybody to go for the Stockholm Convention requirements. That means prefer alternative treatment technologies like autoclaving or microwaving, or go for high temperature incineration. The decision which way to go is sometimes really difficult. So and like again, don't first a lot of people really first think, oh, now we need incinerators everywhere, yeah, because of the waste. And that's in really most situations not really necessary, because there are capacities available already, and just first assess really in detail what is there and use as much as possible.
Thank you. Thank you very much. And all attendees, please accept my apology for the time management. I will do that as quick as possible to accommodate your comment when we close by no more than 15 minutes from now. Can we go for the second round of questions? We have a live question from Dr. Bulan Thapa. Dr. Bulan, and then Sudan Panti. Sudan, if you are already have mic, please deliver your question.
Okay. Okay. Thank you, Dr. Thakas. Just regarding the disinfection and the chemical used, nobody is speaking about the contact time. Contact time is major thing we have to consider, and that WHO also saying, and the maximum concentration of the sodium hypochlorite is, that is the 0.5% for blood and body fluid that Ute also mentioned. Why India is using 1% and not talking about the contact time? One thing, and another thing is the recycle also. In case of the COVID-19, normally we don't consider recycle of any of the waste. There is some risk, so that, let's forget about the recycle on this context. Thank you, Awad.
Thank you. Thank you. Before go to Thapa, we have a question from Rajaram about how we manage the PP and masks, if we have to clean it or use it. We have a question, and face shield as well. We have a question from Inda Devi talking about what the protection for those who cleaning staff and those who work with waste. So I put a question. Can I go to Dr. Bulan Thapa?
Dr. Meg, Dr. Bulan has got disconnected, so you may ask.
Okay. Dr. Bulan asked about how we can promote the implementation. They said he asked that we have guideline and SOP and how we really make it into action, and they got he got a lot of support from the other attendees. One is Dr. Tej Prakat saying that it should be promoted as a social responsibility as well. Can I go to the Mr. Kamalech Sakar?
Yeah, hello.
Yep,
can you hear me?
Yep, 30 seconds, please.
Yeah, I just want to know, is there any categorization that this material is highly infectious, this is moderately infectious, and this is lowly infectious?
Yep, apart from just one label as infectious, right? Okay, thank you. And then we have Dr. Manjit give a comment that on one hand, we have the issue of access to infrastructure in low resource setting, but there's a very big role of behavioral change in community. In the pandemic situation, when there's a large scale of use of PPE, we see a lot of implementation challenges, and careless behavior aggravate these risks of spreading of infection. My question, Mr. Manjit, question to Dr. Malini, with your experience, what are the key 1 or 2 steps that can be game changer in the implementation of waste management? Now, can I go for the last round to all panelists again? Then for your final word and respond to a few questions. Okay, Dr. Malini. Please unmute your mic.
Am I audible?
Yep, please.
Yeah, okay. Thank you, Dr. Manjit. That was a very pertinent questions, like what are the things, what are these strategies, what are steps which can be game changer in the implementation of waste management. Herein we need to divide like the general population using these PPEs and the healthcare waste, the hospital setting. So if you look at the general population using PPE, it's best is to use cloth masks. They can wash it, iron it, reuse it. So we need to differentiate that. And if they are using 1-ply or the 2-ply or the 3-ply mask, if at all they're using, we can take cue from the CDC guidelines that you need to keep your mask for 72 hours. And since the virus has the retention time there, and after that you keep your mask in 72 hours in a paper bag, you mutilate them so that there is no pilferage. The second is in the hospital setting. Now US FDA has also given like N95 mask, they can be reused using the steroid technology, and face shields also can be reused. So about this much of recycling is found. And as far as what are the game changer, you need to follow the best available techniques like autoclaving or microwaving, and best available practices, follow the WHO guidance on the disinfection policies, and you know, limit your category of waste which goes for incineration. And it's a very important public health concern, and in fact it's an essential, waste management should be counted as an essential health service which can only be taken care of if it is included in the legal guidance also, and as part of social responsibility also. COVID is a big game changer, I would say, that healthcare waste management, which was a neglected aspect, it should be taken as an of utmost priority, that it's a social responsibility of all the stakeholders, whether you are in the hospital setting or in the community setting, or are the sanitation workers. They are an important part of COVID war. And in fact, the inspecting agencies or the regulating agencies also have an important role to play. Thank you.
Thank you very much. I have additional question on from the Yangon General Hospital talking about effectiveness of UV unit as well. Can I go to the Mr. Mahesh, please? Mr. Mahesh, please unmute your mic. The floor is yours.
Yeah. So I think this time I think we have to thank COVID, though it is a problem for everyone, for us, but COVID has brought up a very big issues of PPE and hand washing. Because in the past we have when we do practically, we have difficulties to even convince to wear the proper PPE to the hospital staff, and also do hand washing regularly. It was a big change brought by COVID-19. I have to thank COVID-19 to bring this. We have a very bitter experience of in the past about hand washing and PPE. So PPE, I think in that aspect, there are a lot of PPE available now. The question is PPE standard. What kind of PPE standard should be there? This is not clear. Yep. So I want to suggest maybe WHO should host some kind of meeting focusing on PPE and discussing more on discussion, because we always prefer to do single-use. PPE has created a lot of issues in the country, even because there are so much of waste by PPE, and it is very difficult to do the treatment. So we are promoting the reusable PPE. In that context, a lot of reusable PPE has been produced in the country now, and our Nepali government has already made a standard on PPE also. That is our first standard has been developed. So government of Nepal is already doing that. So, but we have a technical questions on PPE. What kind of PPE we should use? So I think that I suggest that we should have an international discussion on that. Of every country have several experiences on PPE, and we have to do that. Same way with the mask also. I suggest a lot of different type of masks. That's my I think that's what I want to say. It should have a still discussion, and after to copy, but we can have another type of pandemic soon. So we have to be before that.
Yeah, thank you very much. Your message is well noted. Can I go to Digit Ahmed, please? Your last word of wisdom, please.
Yeah, thank you very much. I think for the game changer of the waste management, it is always three things: the duty of care, social responsibility, and behavior change. All the other things comes later. If we can adopt all these three principles, then we are doing fine. That is the game changer, of course.
Okay, thank you very much. And lastly, Dr. Ud.
Oh, there are so many questions.
yeah, you are very popular in chat box.
I will try to make it short. So there was one question on recycling after disinfection of waste. this is possible if you have a really safe disinfection capacity, like when you use an autoclave and you have, like, for example, syringes, plastic syringes, which we are autoclaving and disinfecting. You are doing some tests so that the disinfection method is really working well, and it is pretty much possible to recycle. So this is actually also done in a couple of countries I'm working in. But you really have to make sure that it's really working efficiently. So this is the one point. PPE, waste handlers, like I just mentioned, the waste handlers should be equipped with proper PPE. But that means boots, long sleeve gowns, heavy duty gloves, masks and goggles, or a face shield. A surgical or even a cloth mask can protect against splashes and also help prevent workers touching their faces. But for the health workers, like N95 masks are not essential. Yeah, so this is also one of the messages. To classify the infectious waste or waste from COVID patients as highly infectious waste is not necessary. Highly infectious waste is a different category. So please don't make the problem bigger than it is for the waste management. I'm talking about waste management here. Yeah? So waste from COVID-19 patients has to be considered as infectious, not as highly infectious. And don't think that all waste now, which is then generated in a hospital, needs to be disinfected. Yeah. Just establish your normal segregation system there, and just enforce it properly. Thank you.
Okay, thank you very much. Yeah, so a few questions about the contact time of disinfectant as well. But all ladies and gentlemen, I think that we have a very good 1 hour and 5 minutes. But before we closing, we would like to hear some summary. Please feel free, if you want to contact us panelists, we can be your postman. But at the moment, can I go to Mr. Rashid, our regional advisor on water sanitation? Please, Rashid.
Thank you, Dr. Mack, and thank you all the panelists for the valuable contributions. I think one of the most critical and important thing from today's and always have been the importance of sustainable best practices and that are low cost in technology, appropriate to national and international guidelines and environmentally sound options which are available. WHO guidance on WASH and waste management for the COVID virus, safe management of waste from healthcare activities, and WASH fit training modules, which all will be available. And the presentations of today's webinar will also be available. During pandemics, it is important to make sure that healthcare waste is properly and safely collected, treated, and disposed of. And key takeaways from the webinar, I would say that we need to accelerate our efforts and strengthen governance to tackle healthcare waste during and beyond COVID-19 pandemic as an integral part of overall waste management framework. The evidence-based context of friendly and affordable healthcare waste management processes. We need to definitely look into the planning with involvement of empowering of key actors through the whole process, right action at the right time, importance of to segregate hazardous and non-hazardous waste at the point of generation, risk management and affordable technologies, good practices and WHO guidelines and tools that are available needs to be utilized and implemented. With this, I give the floor back to Dr. Mack. Thank you.
Thank you. Thank you very much. This is a huge challenge, and of course, we don't want to have this crisis go waste. So, but you have to manage waste in this crisis as well. Thank you very much. That is a great 1 hour and 10 minutes. Can I thank all panelists, all participants for your questions, and I show one slide for next week. Please feel free to extend our invitation for this Healthier Population webinar series. Next week, we are talking about 2 important issues. One is how can e-health come and help strengthen the frontline NCD and mental health service. We will have the lesson learned from Bangladesh, from India, 2 from India, and then maybe 1 from the other. Okay, please feel free and join us again this Thursday lunchtime. For now, thank Thank you very much and see you next week. Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you for our analysts. Bye. Thank you very much.
Thank you.
Thank you. Bye-bye.
Thank you very much.
Ute, bye-bye.
Thank you very much, Mr. Mahesh. Great.
Bye-bye.
Great
Thank
to
you.
have you, sir. Thank you very much, DG, Amit,
Malini.
and Dr. Malini. You have a lot
you.
of praise
Thank you.
in
Thank you,
chat box.
Mac. Thank you very much.
Yeah, it's great honor, please.
Yeah, thank you.